How medical massage can help post-COVID recovery. My name is Dr.Ross. I'm founder of Science of Massage Institute located in Phoenix, Arizona. In this short video, we will discuss very common thing, which is COVID infection, and everybody familiar with that. What actually happened in significant number of patients who completely recovered from COVID infection is the fact that they develop so-called post-COVID syndrome. And this post-COVID syndrome is very strange and never seen before set of complications. They are fatigue, they are different sensory abnormalities. For example, people losing taste, they start to hear tinnitus, they start to have difficulties with vision, they start to have alternation in the smell. So all of that in combination with fatigue, with muscle weakness, create very unpleasant time, which sometimes can run for months. And there is a recently accepted view that post-COVID syndrome is almost independent pathological condition. So can medical massage help those patients, or medical massage practitioners, can they actively participate in the treatment of the patients who recovered from the COVID infection? And the answer is yes. First of all, any kind of lymph drainage massage dramatically help patients with recovery from any viral infection. And that is things for the practitioners to remember. But the COVID has very unique impact on human body. We actually never saw that before, because what it does, it alters sensory cortex or sensory perception, which come from different receptors. It can be your eye, it can be your receptors are responsible for the taste buds, for the hearing. So for some reasons, these peripheral receptors are not deliver correct data to sensory cortex. And sensory cortex confused and create these very disturbing clinical symptoms which alter sensory background of our normal healthy interaction with the environment. So from that perspective, medical massage can be another help, because if we look on full body massage session, when full body massage session and practitioner work on large muscle group, large area of the skin, of the fascia, what he does, he first of all activate peripheral receptors. Peripheral receptors, it doesn't matter what, it's posterior corpuscles, it is Golgi tenor organs or muscle spindles or nociceptors, it doesn't matter. All these sensory receptors which activated during full body massage session, they're sending sensory input to the sensory cortex of the patient. And this sensory input with repetitive application start to reset patient's sensory cortex and balance activity in apparatus which able to process data from the sensory receptors which were affected by the virus. From that point of view, massive activation of peripheral receptors on the patient body allows to reset sensory cortex, and sensory cortex in its own terms able to now correctly read information from the peripheral receptors affected by the COVID, which can be hearing, taste, smell, vision, and all the complications patients suffer from. And another aspect of that is muscle weakness. There is a lot of stimulating techniques in the medical massage arsenal which allows additionally stimulate skeletal muscle which is now affected by the waste developed by the virus and which is saturate muscle tissue and interfere with normal blood flow and normal muscle contraction. So right now, working with the large muscle group, using proper combination of very powerful kneading techniques, therapist able to help skeletal muscle to recover, to regain what is lost during the weeks, sometimes months of being fatigued and being in inactive state. So combination of all of that allows as a framework choose by the therapist what he or she would like to specifically apply at different stages of the COVID or infection or post-COVID recovery. Some of you work on the patients with post-COVID syndrome, and maybe you have your own experience you can share with other therapists. And this experience from the first line is critical to share with people who are not familiar with this treatment option. So if you would like to leave your comments and start discussion, and we can exchange ideas for the patient benefit, and that's what's important. Thank you for watching. Let's stay together and practice medical massage for the patient's benefit who are in dire needs. See you in the next video. Thank you for watching.